Hi everyone, my name is Jenna Riley. I'm a licensed dental hygienist and oral health educator with the Delaware Division of Public Health. Today I want to share with you why dental care is such an important part of prenatal care. Here are some things every pregnant woman should keep in mind about their oral health as they navigate their pregnancy journey and prepare to welcome their new babies. Just as pregnancy changes things about your body, it also changes things about your mouth. Pregnant women are at an increased risk for oral health conditions such as cavities because we're snacking more between meals, we're combating those cravings and that nausea. We're at an increased risk for gingivitis. That's because of the increase in the hormone progesterone that we experience during pregnancy. And also we're at an increased risk for gum disease from the untreated gingivitis. Pregnancy hormones make it easier for bacteria to grow, unfortunately, and they also make our gum tissue more sensitive to that plaque that gathers on our teeth when we skip brushing or when we don't do a great job brushing. Even if you're a great brusher who flosses regularly, though, you might still notice your gums bleeding during pregnancy. It's also important to note that if you already had gingivitis or gum disease before becoming pregnant, pregnancy can make that worse. Your oral health can have an impact on your baby's health during pregnancy. When we talk about gum disease, we're really talking about inflammation in the gums. That inflammation doesn't just stay in your mouth. It can travel and affect your whole body. Research shows that inflammation from gum disease can increase the risk of premature birth and low birth weight in babies by triggering prostaglandin and cytokine production to stimulate labor. The good news is there's a lot you can do to protect yourself and your baby. You can lower your risk of gingivitis and gum disease just by brushing twice a day and flossing once a day, and seeing your dentist every 6 months, even while you're pregnant. That brings us to our next slide. It is safe and recommended to see a dentist during pregnancy. I wish I could shout that from the mountaintops. Both the American College of Obstetricians and Gynecologists and the American Dental Association agree that dental care during pregnancy is safe and encouraged. It's always important to tell your dentist that you're pregnant so that they can take any extra precautions to keep you and your baby comfortable and protected. If x-rays are needed, your dental team will provide extra lead aprons for protection. X-rays are considered very low risk in general, but it's completely your choice. You can always talk with your dentist and your OB to decide if x-rays can be postponed based on your specific case and comfort level. If you need a procedure that requires numbing, like a filling or an extraction, the second trimester is the safest and usually the most comfortable time to take care of it. A professional dental cleaning from a hygienist in a dental office during pregnancy is a great way to reduce inflammation in your gums to help keep your mouth and your body and your baby healthy. Babies aren't born with the bacteria that cause cavities. Those bacteria are actually transferred from parents or caregivers, most often the mother, to the baby. This transfer usually happens through saliva. Simple things like sharing utensils, tasting your baby's food or bottle, or putting a pacifier in your mouth to clean it can pass cavity-causing bacteria to your baby. Transmission can happen even before your baby's first teeth come in, but if mom doesn't have any active cavities in her mouth, she has a much lower chance of passing those bacteria on to her baby. If we can prevent that transfer, especially before age 2, a child is likely to have less cavities as they grow up. One of the best things you can do for your child is set a healthy example by showing them how you brush twice a day, floss daily, eat a healthy diet low in sugar, and how you visit the dentist regularly. Keeping your own mouth healthy helps your baby's chances of having a healthy mouth too. The American Academy of Pediatric Dentistry and the American Dental Association both recommend taking your baby to the dentist by their first birthday or within 6 months of the first tooth coming in. The first visit isn't just about checking the teeth, it's a great opportunity for counseling and guidance. meaning your dentist or your hygienist can show you how to care for your baby's teeth and gums and what to expect as they grow. Seeing the dentist early also allows for early intervention if anything unusual is developing. It also allows for us to catch small issues early so that they don't become big or more expensive issues later on. Before your baby even has teeth, it's important to wipe their gums after each feeding with a clean washcloth or a dental wipe. Remember that both breast milk and formula contain natural sugars that can stay on the gums. Once that first little tooth appears, usually around 6 months, start brushing with a tiny smear of fluoride toothpaste. Fluoride helps strengthen the enamel and protect against cavities from the very beginning. Baby teeth are important. I like to say baby teeth are little teeth with big jobs. They're so important to a child's overall development because they ensure proper chewing, which enables a child to have a healthy, nutritious diet. They ensure proper speech development. As we know, our teeth work together with our tongues to form all the sounds of the letters in the alphabet. They hold a space in the dental arch until those permanent teeth are ready to come in. If they're lost too soon, all the teeth will shift and move in the mouth, which results in the child needing braces most of the time. The baby teeth contribute to the development of our facial structures. They contribute to self-esteem and confidence in little children as they grow up and they move into preschool and kindergarten, and there's a big psychosocial effect that they have, and they just contribute so much to their overall health, as we know that having poor oral health means infection and inflammation in the mouth, which can travel to other areas of the body. And as you can see from the chart here, some of those baby teeth are not lost until a child is 12 years old, sometimes even later, depending on a child's individual development. So 12 years is a long time to have a tooth in the mouth, and we need to make sure that we're doing everything that we can to keep those teeth healthy for as long as they're around. Teething usually begins around 4 to 6 months, so wanted to take a few minutes on this slide just to talk about some of the do's and don'ts of teething. When your baby starts teething, you may notice an increase in drooling or saliva production, and you may notice their gums are a little redder, a little puffier. So some of the things that we can do to alleviate some of that teething pain is offer a clean teething ring or a cold, wet washcloth. Cold temperatures are soothing and they help to numb the nerves that transmit the pain. So anything that is cold is going to help soothe baby. Again, we want to make sure that it's just chilled, not frozen. We never want to offer anything frozen to baby because it can actually burn the gums and harm the baby's gums. So we don't want to freeze it, we just want to chill it. Anything that is hard plastic, sturdy rubber, as far as teething rings, are also safe. And then simply just massaging baby's gums with clean fingers can provide a lot of relief as well. Some things that we don't recommend. We know it's not safe to offer baby a soft liquid-filled ring. Of course, anything that is soft and has liquid inside of it, we run the risk of baby's sharp teeth puncturing that and then baby accidentally eating and drinking that liquid, whatever that may be, so we don't recommend that. We also want to discourage teething biscuits, which can break off into baby's mouth and pose a choking hazard. They also contain unnecessary salt and sugar, which we don't want to introduce to baby's mouth, baby's teeth this early on. A big one is no more Orajel. The FDA recommends that parents stop using any kind of Orajel product or anything that offers a numbing agent like benzocaine for children younger than 2 years old. It can be extremely dangerous for them to use products with this numbing agent in it. Even if it says it's organic or homeopathic or all natural, we know it is not safe to use any kind of product that has a numbing agent in it for teething. And then also teething necklaces, which have gained a lot of popularity over the last couple of years. They can pose a choking and a strangulation risk, and they also have not been proven effective anyway, so they're just not a safe option for infants. So we don't recommend those. Any of the things under the do category are effective and safe and recommended. So in general, children need help brushing usually until age 7 or 8 or until they're old enough to tie their own shoes. So certainly when they're in the earlier ages, they need help brushing their teeth. They do get independent and they like to take the toothbrush and do it themselves, and that's fine. It's good for them to get a feel for the toothbrush and get a feel for how to brush, but it's important still that a grown-up goes in after them and helps them do a truly effective job of brushing their teeth. And something else that we like to make parents aware of is that when you're brushing, you may need to help your child to lift their lip, because one of the areas where we see cavities most commonly in young children is right underneath that lip, that upper lip along the gum line. So on the picture in the right, you can see the early stages of some cavities, and that's that white chalky appearance that goes right along the gum line. That's actually a very, very early cavity. So we want to make sure that we're hitting those areas with the fluoridated toothpaste. When the child goes to the dentist will also lift the lip to check that area very thoroughly, as you see in the picture on the left. So we want to make sure that we're cleaning there very well in addition to everywhere else in the mouth. But we need a grown-up to help us do that. So make sure that you're helping them brush and lifting their lip. When we talk about how to brush and how often, it's the same as it is for adults, twice a day for 2 minutes. The big difference, though, is the amount of toothpaste that we use. So when children are 0 or 1 or 2 years old, we simply use a smear of toothpaste, as you see on the toothbrush in this picture. Just a tiny smear, no bigger than a grain of rice. A little bit goes a long way. So that's enough toothpaste for them to get the benefits of that fluoride on their teeth without having any of the ill effects that can come from swallowing too much. Of course, we want to help them brush. We like to do little circles with the toothbrush for a full 2 minutes. You can use a timer or sing a song to help you gauge whether or not you've hit that 2-minute mark. But we want to also encourage them to spit to the best of their ability. But we know that if we're just using a smear of toothpaste, anything that they swallow is not going to make them sick to their stomach or have any adverse effects. Once they're over the age of 3, we can use a little more toothpaste, but not that much more, just the size of a pea. So we want to brush for 2 minutes daily, just with a smear of toothpaste until we get to that 3-year mark where we use the size of a pea. Some other tips: once baby has teeth that are touching, we should try to start flossing to clean between where the toothbrush can't reach. You can use traditional string dental floss or you can use floss picks. Either one is a great choice as long as we're getting in between, swiping that plaque away, and getting in between where the toothbrush can't reach. As we start growing and introducing new foods, we should limit sugary drinks and snacks, especially snacks that are both sugary and sticky, because that is the perfect recipe for a cavity. We want to wean off the bottle by 12 to 15 months. I know it's hard, but they do have transitional sippy cups and things like that. If you talk to your pediatrician, talk to your dentist about what that progression looks like and how to make it easier on you and your baby. And then we want to get rid of the pacifier by age 2 if possible. Again, that's a tricky one for many parents and many babies who have grown very attached to that pacifier. It can be difficult, but ask your dentist for tips and tricks to kind of help that process move along more smoothly, whether you limit the pacifier to naps or bedtime and you gradually wean the baby off the pacifier altogether. We like to see that by age 2, because if we have prolonged use of the pacifier, it can change the way that the teeth grow in, the way that their jaw is shaped, and all sorts of orthodontic problems can arise from using the pacifier for too long. So there's so much information that we can't cover here all today, so I just encourage you to utilize your dentist, ask your pediatrician. If you have questions, make a list of those questions so that when you go to your dental appointments, they can give you answers. They can give you more resources to anything that you want to learn more about or that you may need help with. I want to let everyone know that help is available when it comes to finding dental care in Delaware. You can call the Delaware Dental Helpline Monday through Friday from 8 a.m. to 4:30 p.m. There are people there who answer that phone line, who are there to help you, answer questions you might have about finding a dentist or getting connected with dental insurance if you don't already have coverage. There's also the Delaware Dental Resource Guide, which is packed with information on low-cost dental options across the state. Information about how to sign up for insurance, how to make the most of your benefits, how to find a dentist near you. You can actually scan the QR code right on this slide to open that guide directly on your phone or tablet. And you can learn more about oral health during pregnancy and throughout the lifespan by visiting DelawareThrives.com at that link there. And if you have questions or you need help getting connected to resources, you can always email me as well. My email is that jenna.riley1@delaware.gov that you see at the bottom there. And I just want to thank you all so much for your time and attention today. And I wish each of you a happy, healthy pregnancy. And remember, taking care of your smile is part of taking care of your baby. Best luck and best wishes, and everyone take care. Thanks. Bye.